Pain is inevitable, and it is something that many individuals face in their life. Some face short periods of pain, sometimes pain can come and go, and others face a lifelong battle with pain. As I have spoken previously, I work with a few individuals who have been diagnosed with cerebral palsy. Their diagnosis has left them with some permanent physical impairments. These individuals have experienced from a few to many surgeries to try to improve these malformations they have developed through their physical development. As life has progressed, they have had to adapt and attempt to manage increasing levels of acute and chronic pain. Through their growth, they have attempted many methods of pain management, leaving them dependent on pharmaceutical drugs to relieve the pain. Since my time with them, I have experience with non-pharmaceutical approaches to pain management with proper authorization and training. Although pharmaceutical approaches have been successful with these individuals, it has resulted in some unwanted side effects from the medications they have taken, such as irritability, fatigue, depression, imbalance of emotions, and on and on. Through our discontinuing the use of narcotics, I have witnessed firsthand the benefits of using non-pharmacological approaches to pain management. Today I want to explain and hopefully persuade you to why decreasing the use or frequency of pharmacological methods of pain management can increase someone's quality of life. So let's first look at some of the dangers of using prescription medications for pain management. Although it has been reported by David Simon, Medical Director, CEO, 2014, that opioids and prescription drugs is a common practice to relieving chronic pain, and according to experts, it is necessary and a life-saving part of pain management. However, according to the CDC in 2014, 100 million Americans suffer from chronic pain. An estimated 11% of adults experience daily pain, meaning millions of Americans are prescribed and treated with opioids for chronic pain. 2 million Americans abused or were dependent on prescription opioids, and 15,000 ranging from 25 to 54 died because of an overdose. So although using prescription drugs for pain management has been reported effective, it has left some detrimental effects on society and those who use them, such as dependency and death. So why would we want non-pharmacological methods? Why are they safer? Non-pharmacological methods are less invasive and more cost-effective, meaning they require less spending money, and their approach is a lot easier, a lot more accessible to people. The risk of becoming dependent on drugs decreases along with your chances of death. According to JMCP 2014, annual cost for analgesics was $1.9 billion, opioids was $3.6 billion, and adjuvants was $12.3 billion. So as you can see there, that's a lot of money coming out of Americans' pockets that most of these people can't afford to pay. Methods can be learned by anyone and are more accessible to the public. So these non-pharmacological methods are a lot easier to obtain. They can be taught to anybody, anyone can learn them, and you can honestly access these methods through online education or by reading a book or a magazine. So let's look at some of the more least invasive techniques used. There are a wide range of pain management techniques that individuals can use to treat a wide variety of symptoms. Some more common methods include physical involvement, such as physical exercises, which strengthens muscles, supporting joints, improves alignment, and releases natural endorphins. Physical therapy is another example, which is specialized movements to strengthen weak areas of the body. Feldenkrais, I believe, therapy that builds efficiency of movement. There's biofeedback, which is using a special machine becoming alert to body processes such as muscle tightening, and you learn to control those muscles. And there's acupressure, which is putting pressure on a specific point on your body to relieve pain in a certain area. Nutrition plays a huge role in how our bodies react to pain. There's an anti-inflammatory diet, which is a Mediterranean eating pattern, which consists of whole grains, fresh fruits, leafy vegetables, fish, and olive oil. And ultimately, living a healthy lifestyle would have a huge impact on your pain, such as building healthy relationships, creating positive environments such as work or school, and exercising regularly. I think the most important aspect of relieving pain and pain management without using prescription drugs is our brain, which is a powerful tool. There's a practice called mind-body medicine, and it focuses on teaching the brain new habits to relieve pain. Some of these could include like meditation, which is relaxation, distracting your brain. There's guided imagery, where you ultimately think of an environment, you build a scenario in your head, and it distracts you from the pain. And a good example of this is a girl named Cynthia Toussaint, which developed a complex regional pain syndrome. And for many, many years, doctors could not diagnose her. They thought she was crazy. They recommended her to psychiatrists. She was denied treatment. And ultimately she tore a hamstring from dancing. And she developed this complex regional pain syndrome. And if treated early, it could be reversed. But since treatment was denied for her, she came about a lot of problems from this. After 15 years, she was given treatment, drugs that had many side effects. As we all know, drugs do have side effects, unwanted side effects. And eventually she got to the point of so much pain that even clothes hurt. Just touching small contact would hurt her tremendously. So what physical therapists did was use guided imagery. And they distracted her brain by having her picture herself dancing, in these dancing scenarios. And it involved some deep relaxation, and it's scientifically proven to improve pain. So that's just one example. So as you can see, there's a lot of methods out there that could be helpful, and that people should already know. Pharmacological approaches to pain management and treatments can be very dangerous and costly. Although these approaches are effective to relieving pain, they can ruin someone's life. With safer, non-pharmacological approaches, we can continue to improve individuals' lives and make their lives worth living. Pain management should be viewed as a lifelong process. But as we keep living, we also keep striving to be better and stronger versions of ourselves. If we can promise not to give up on ourselves and to keep pushing for a better tomorrow, then we should promise to make healthy decisions regarding our well-being and for our future. Thank you.